the way the medications work is they sort of lower some of the frontal cognitive processes of the brain, and whatever sort of grip the patient might have on reality starts to fade away, and then a lot of emotions surface, a lot of things, fears, anxieties, traumas, a lot of things come up. And in that process, it really, the surgery itself acts as an opportunity, whether it's done consciously or subconsciously, acts as an opportunity for the patient to live out and experience those things.
Hello, and welcome to the Mindfulness Experience podcast. I'm your host, Keith Fiveson. I'm thrilled to bring you another episode guaranteed to inspire and enlighten you. As an official media partner for the Wonderland 2023 conference, we're bringing you the very best of the experts and thought leaders who are shaping the future of health, wellness, and mindfulness. Today, we have an extraordinary guest who is a true pioneer in his field, Dr. John Kanevsky. He's a medical doctor, S03E87, and a board-certified plastic surgeon and fat grafting expert, transforming the cosmetic surgery field with his unique approach called surgery as a ceremony. Dr. Kanevsky's commitment to holistic healing, his deep understanding of the body-mind connection, and his use of cutting-edge technology are just a few of the reasons why he stands out in his field. We'll talk to Dr. Kanevsky about his journey, philosophy, and his latest developments in plastic surgery. So without further ado, let's welcome Dr. John Kanevsky. Hey, Dr. John, how are you?
I'm doing great. So great to meet you. Thank you for having me on. I appreciate you giving me that beautiful intro. I'm happy to connect with you and discuss all the things that you want to talk about today.
I really appreciate that. And, I'm looking at your bio and I'm looking at all the transformative work that you're doing. And I really appreciate what you're doing for people's lives. And you're really approaching plastic surgery in a new way. Can you talk about, how it differs from traditional methods and your approach a little bit more, Dr. Kanevsky?
The patient journey that I have been a part of throughout training and my years of practice has shown that the mind is an integral part of the recovery and the healing experience for patients. How they see their body, the stories, anxiety, fear, trauma that they've carried throughout their lives is directly related to how they see and feel about their body. And so that, traditional plastic surgery has to do with the actual appearance of the physical body and focusing on the physical body from a mechanical sort of perspective, but addressing the patient's concerns and approaching the procedure that they're undergoing from a mental and spiritual aspect adds this extra layer of awareness to the patient experience, so that when they're undergoing this transformation, it's not just focused on the body, it's the mind as well. And what I've noticed in approaching patients from this experience is that their ability to meet the new self after a procedure is dramatically improved compared to traditional methods, from a recovery standpoint, but also from the mental and sort of newfound spiritual standpoint.
So, Dr. Kanevsky, when you look at surgery as a ceremony, it sounds like you're really bringing a lot of intention and mindfulness in terms of sort of really projecting and intentionally bringing this new transformative self into the approach that you're using to healing and transformation. Can you talk about how you manifest that and what that really looks like as a part of, ceremony? Is it truly ceremony? What happens in that process?
Yeah. So surgery as ceremony came about as a concept after witnessing many patients go through their procedures and having these profound shifts in the psyche. And what I
Hmm.
mean by that is a lot of the surgery I do is for patients who are awake and medicated, but they're still awake and conscious throughout the experience. And what I started to notice is that patients, once medicated, their guard starts to get let down because the way the medications work is they sort of lower some of the frontal cognitive processes of the brain, and
Hmm.
whatever sort of grip the patient might have on reality starts to fade away, and then a lot of emotions surface, a lot of things, fears, anxieties, traumas, a lot of things come up. And in that process, it really the surgery itself acts as an opportunity, whether it's done consciously or subconsciously, acts as an opportunity for the patient to live out and experience those things, whether they're letting go of the ego or thinking about things that they've been suppressing, whether it's trauma that comes up.
Hmm.
And after doing several thousand of these procedures, I noticed a pretty consistent number of patients having these kind of responses.
Hmm.
Um, so
Hmm. Hmm.
um, it started to get me thinking because of my own experience in the world of ceremony and also my spiritual path. I started to see some similarities. So the similarities between surgery and ceremony are really three key ones. The first is that both in surgery and ceremony, a patient has a strong desire to, or the person has a strong desire to transform,
Hmm.
whether it's a spiritual or physical transformation. The second is that there's usually an altered or elevated state of consciousness, whether it's through meditation or fasting or some sort of plant medicine, or in the case of surgery, it's actual medications that
Hmm.
are used. And the third is you have to go through the journey. Like there's just no way to get to the other side, but to go through the experience. And with that comes some challenges, having to work through whether it's physical or emotional things. And those similarities are so true for both that it was like a light bulb turned on for me one day when
Hmm.
I was in surgery. I said, how is this surgical experience, how is this ritual any different than a traditional ceremony that patients would go through,
Hmm. Hmm.
or somebody seeking a major transformation? And keeping that in mind, it made me think about every surgery I do as an opportunity for a profound transformational shift for a
Hmm.
patient that they could then, surgery is really like for most people, it's a once in a lifetime opportunity. And to
Yeah.
use that experience as a way to create lasting, transformative, a shift in their lives. And not just to have a change in the body, but also a change in the mind.
Yeah.
The interesting thing is that surgery really, also for a number of other reasons is a lot like a ceremony. We just don't really acknowledge it like that anymore. The surgeon
Hmm.
will wear a traditional ceremonial garb. We don't think of scrubs that way, but it really is like, we
Hmm.
wear this ceremonial kind of ritualistic clothing.
Right.
Patients have to follow a certain preoperative protocol about whether it's fasting before surgery or avoiding certain medications, which could be
Hmm.
seen very similar to like the traditional dieta or
Hmm.
other rules that you might follow before a spiritual ceremony.
Hmm.
Um, and so there's just, there's this spectrum between surgery and ceremony, but I really feel like they lie on this equal plane, and it's just a question of how we shift our view on the experience and what the outcome is like.
It's wonderful because it sounds to me like what you're doing is creating a safe place, a place where people can really let themselves move into, very much like the caterpillar in the womb, and you're providing the setting, and within that concept of the set, you're then giving them the opportunity for transformation and allowing them to envision the change that they wish to see. So it's a beautiful metaphor, and I really like that. Do you integrate other modalities and other practitioners into the work?
Absolutely. So surgery ceremony is a three-step process. The
Mm-hmm.
first involves working with a therapist, and in this case, it's a ketamine-assisted psychotherapist. So, a traditional psychotherapist that has done and completed additional training on working with ketamine.
Mm-hmm.
And the patient will undergo a series of sessions with a therapist, one of which involves a ketamine talk therapy session. And the
Mm-hmm.
purpose of that session is to address any fears, anxiety, trauma, basically to really prepare the body and mind for the procedure, but also to get really clear on the intention about why it's being done. And I work closely with the therapist to get a better understanding of the patient's intention. And then that leads to step two. Step two is the actual surgery itself, which is done
Mhm.
also in a very ceremonial kind of way. Music is used in both the ketamine session with the therapist and the
Mhm.
surgery, as well as different tactile cues, vibrating stimuli. So there's a lot of intention and ceremonial elements that are brought into both of those sessions. So step one is the therapy session. Step two is the surgery, and which I also use ketamine as the anesthetic, and
Mhm.
I help the patient come into the surgery with a ceremonial uh, kind of approach, but also, recalling the things that they addressed in the therapy session. I always have patients set an intention before the procedure, what it is that they
Mhm.
want to feel, think, and see
Mhm.
about themselves and their body afterwards.
Mhm.
And then after, the third step of surgery or ceremony is body work. It's working with
Mhm.
usually a certified lymphatic therapist who helps ground the experience back into the body within a somatic experience. So the three steps of surgery or ceremony are working with the different providers. The first is the psychotherapy. The
Mhm.
second is surgery with me.
Mhm.
And then the third is working with a body worker. And that
Mhm.
happens over the course of 3 weeks. And what's
Mhm.
interesting is research has shown that having these spaced apart ketamine
Mhm.
sessions,
Mhm.
as well as a real intentional way of approaching this, creates
Mhm.
long lasting neuroplasticity that is very effective at treating anxiety, depression, and OCD,
Mhm.
as
Mhm.
well as any post traumatic stress.
Mhm.
Tied together with the experience of recovering after surgery, it really creates a powerful modality that helps people shift their mind and body.
I love that. I mean, it really parallels the, set setting and integration work. And you're really then using not only a lot of the similarities, but you're helping people to activate the changes in their life through the integration process so that they're not rejecting the work or getting tied to what was and what is. They're really working through that process and really accepting and looking at their new self with new eyes. And
Correct.
that sounds wonderful. So there is this, you really do focus on the mind body connection that's at the core of your work. And then you counsel patients to really prepare mentally for surgery. And it sounds revolutionary to me, honestly, because I've seen the health, when we look at healthcare, I've seen the care come out of the health care, and you're really using an approach that seems very, not revolutionary, seems very basic in terms of how we should care for people. Yeah.
Thank you for saying that and for seeing it that way. That's exactly my hope and
Hmm.
intention, which is to bring back a real holistic side as well as whole person approach to what is traditionally not really done in the world of plastic surgery.
So, can we talk a little bit about, maybe some of the most transformative cases that you've worked on and what sets them apart? Perhaps, obviously no names or anything else like that. Changing the names and changing the places. Perhaps it's up to you.
Yeah, yeah.
What can you speak to? Hmm.
Of course. So I'm happy to share these stories without sharing any names or anything
Hmm.
like that. But some of the more powerful stories
Hmm.
have to do with a very specific patient population I work with, and that's women who have either had breast cancer, who have had breast implants and have had them removed, and or women who also want to create some change to the breast, usually an increase in the breast size. So I personally stopped using breast implants about 5 years ago. I just don't think they're safe. And
Hmm.
what's happened is there's several generations of women who have been really harmed by implants. It's either led to systemic symptoms in their bodies that have caused them to get very sick, um,
Hmm.
and once the women have undergone a surgery to remove the implants, it then leaves them, with a fairly traumatic experience, having undergone all this surgery. And some women feel very disfigured and disconnected from their bodies. And the same process, unfortunately, happens after breast cancer as well, from mastectomies, the surgery to remove the cancer. So, to kind of preface the stories I want to share is to say it's really women who have suffered both physical, emotional, challenges and trauma from either implants or cancer.
Mm. Hmm.
Um, so some of the more powerful patient experience I've had is there was one woman who had she had uh, undergone implant surgery when she was young. She was 18, and almost 15 years later felt like her implants were making her very sick. So she decided to have them removed. And once the implants were removed, she was really in a challenging place because she carried a lot of shame, guilt, and sort of I would say trauma around these decisions that she made when she was so young that have really impacted and what she felt disfigured her body.
Hmm.
Taking her through the surgery ceremony experience and witnessing the transformation of healing that she had in relation to how she viewed her body was transformative. It was one of the earlier times that I'd done this, the full protocol of surgery ceremony, and what I witnessed was just a totally different person. It's not just that the body changed and she became more confident, it's that she really shed the fear, the guilt, the blame, and the shame that she had associated with her body for so long.
Mm.
As a result of the choices that she had made. And so it was like the way she described it when she was in surgery, as I administered the ketamine, she says, "I finally feel like I'm coming home. I know what self-love is." And that to me was
Wow. Wow.
so powerful to witness because, whether the surgery needs to happen or not, but to physically experience somebody going through a shift like that in the way they view themselves, that's my ultimate goal for every procedure that I do, is to help somebody feel like they're coming home, experience the divinity within, and to reach a place of self-love. And that was really powerful. That's what really set me off on this journey to say, I think this needs to be an integral part of every surgery that I do. And I'm so so just amazed at the transformation she went through. So that's one story. Another patient experience that really touched me was a woman in her 40s who had recently lost her spouse, and she was a mother of three. And she was about a year after she lost her partner, and was very much she'd been doing the work to go through the grieving process, had her own therapy, but she was finally in a place where she was like, I think I want to do something for myself. Like I've been in service as a mother, as a spouse, I've been in grief. And so she looked at this procedure that she was doing as a way to sort of reclaim her femininity and as an investment in herself. And what came up for her during her therapy and surgery experience was this incredible moment of healing in relation to her grief. And the way it showed up during the surgery is so the way I do the procedure is I will administer the ketamine medicine to work and to talk through it, and for anything that comes up for the patient to really surface. And what came up with her was this beautiful vision she had of her husband, of her children. She was able to be there with them and to just have this moment of presence and what she called real deep healing. And when she was going through her healing process, all of that, meaning when I say healing from the surgery, all of that was part of it. In her first follow-up a week later, she came in tears, saying like, I feel so at home in my body. I feel like I've made so much peace and forgiveness to myself, and also in the grieving process, which is something that just doesn't happen in traditional surgery. Patients don't normally go in for surgery and say that they feel like they've addressed or worked through major trauma or even grief in their lives. So that was just another sort of signal to me that this is really powerful work, and that surgery as a ceremony is a powerful tool for patients to really be able to meet and transform their minds as well as the body.
It sounds really very, very sacred to me. And, it's a sacred trust that you're given, within the process of being able to work with someone's fears, uncertainties, and doubts, and their traditional perspective in terms of their own, body image, their own self-talk, if you will. And I'm sure many people that you work with are understandably, when they go into it, they're a little scared because they're dealing with plastic surgery and some of the risk involved. How do you address those fears with your patients?
So I think information and knowledge is really powerful, and that's
Mhm.
always the place that I start. So I like to get a very clear perspective on what patients are afraid of, and I think it's about communication. So patients will often share what they're worried about, and then I provide them the information as best as I know. And no
Mhm.
surgery is without its risks and potential complications. So I try to always share and communicate what I know. If a patient
Mhm.
is afraid about a particular complication or what might happen during a surgery, it's about just bringing that information into the discussion, saying, these are the risks. This is the likelihood that it'll happen. I don't have a magic or crystal ball to predict exactly how things will go, but in the event that something doesn't go as planned, this is also what we do. And there's a reason that I do the procedures the way I do them.
Mhm.
Awake, minimally invasive, with certain medications, is because every one of those steps has an attached safety profile to it. And I think it's, for example, doing a procedure awake rather than under general anesthesia, I do believe is safer.
Mhm.
And the recovery is usually easier too because you're not recovering from those medications.
Mhm.
So but to answer your question, it's always about just providing the best information possible to the patient so they can make a well-informed decision about and readdress any fears they have. If the fears are not related to the procedure and it's more about like deeper life things,
Mhm.
that's I'm always happy to address and talk about those things,
Mhm.
as well as that's why I think the therapy beforehand is so important. It allows
Mhm.
patients to really address those fears. Like, am I still going to be able to be there for my children after the procedure,
Mhm.
or
Mhm.
am I a bad person for wanting to do something for myself? Is something that I've
Mhm.
I've heard before, and these might not be like the usual fears, but those are still the
Mhm.
thoughts that make patients ruminate is important to discuss to feel reassured.
Right. So, I mean, just to be clear, your approach really is combining the science with the sacred, looking at the medical and the mystical and bringing those together. And then for those people who are really concerned, operating from a left brain viewpoint or, wanting to go ahead and really understand, feel secure with the medical side of it, your background and your experience really allows them to feel more secure in that process. And you've developed really some great new technology, this Aura Fill and Lift 360 lipo. That's a new technology you've developed, and it looks pretty cutting edge. Can you tell us a little bit more about that?
Yeah, sure. So the Aura Fill and Lift is basically a fusion of different procedures that have already been existing that I'm bringing
Mhm.
together in a way to create a minimally invasive way to do the traditional lifting and augmentation of the breast only with fat.
Mm.
So fat transfer has been around for a long time, and some of these skin tightening technologies have been around for a long time. But what I'm doing is bringing them together in one procedure that can be done um, either comfortably awake or asleep. And I call it the Aura Fill and Lift. It's really just a fusion of those other technologies that I'm bringing together to create a natural way to augment and the shape of the breast, so to increase the size and fullness of the breast, and also a lifting technique for the breast. This is useful for patients who've either had breast cancer and want to do a breast reconstruction of the breast,
Mhm.
or for patients looking for the more traditional cosmetic augmentation. So it's a basically a two-step procedure. I harvest fat from different parts of the body, and that fat is rich in stem cells, and also the fat acts like seeds that can grow. And then I sculpt and transplant that fat into the breast and use it as a medium to shape and sculpt the breast. Now, for a
Mm.
woman who's had breast cancer and has certain lumps or defect or sort of areas of the breast that they want filled to help them just restore the shape of the breast, this is a good alternative. Or instead of using an implant. My goal is that this be a procedure that replaces implants, because implants for a long time, as we know, have caused complications for patients. And it's hard to predict who gets sick from an implant. So my goal is to provide a safe alternative, which is this procedure, the Aurafill and Lift, fat grafting and tightening the skin without any big scars.
Mm. Well, given what you said about implants before and your approach to it, it really does sound very revolutionary and much safer and more natural in terms of what the actual results are, and certainly working with different kinds of patients. I think that's probably something that they feel more comfortable with, knowing that you've got that care and concern. Let me ask you, the beauty industry has long been criticized for perpetuating, these unrealistic standards of beauty, and I'm wondering how you navigate that pressure. I'm sure you have people coming into your office, with unrealistic expectations. How do you help empower patients to embrace their own unique beauty?
I think that's a great question. Is something that's really important to me as part of my practice,
Mm-hmm.
is to make sure that patients are doing surgery, that are looking to have surgery, are doing it from a place of basically safety and security in themselves. And sometimes that means saying no. And I say no a lot to patients, if I feel like the reason that they're doing the surgery may not actually improve their outcome, and may not give them the outcome they're looking for or make them happy. So the first way I approach it is a really clear consultation process where I get a better understanding of why the patient wants to do a certain procedure. Are they doing it for themselves, or is it to achieve a certain to possibly make somebody else happy, or they're feeling pressure outside outside of themselves? And this is a relatively important but also controversial topic in the beauty industry, which is there's so much external influence, whether it's from social media, from just regular media, and just the societal messaging around beauty standards. Patients will still, regardless of the messaging that's happening, there's also still the concept of body agency and autonomy, and being able to want to make changes to your body and that be okay. So there's a sort of balance between holding space for patients, saying it is okay to make changes to your body, but also, there are some really unrealistic societal ideals and standards that are being perpetuated. So where do we find the medium between that, saying what's a realistic and natural outcome that we can help you achieve versus trying to achieve something that just is not realistic? And sometimes patients will bring in photos and say, like, this is something I want to look like, and I always make a point to say, that's what's possible for that person on their body, or sometimes these photos can be photoshopped. But I have a very clear discussion about what I think the realistic outcomes are for patients on their bodies. And if I do have a sense that the outcome they're hoping for is unrealistic, I explain, I'm sorry, I don't think I can achieve what you're looking for, and that may not be possible with any type of surgery. So it's always about just being very transparent, very honest. If I'm able to understand what a patient's outcome is, or what they're looking for, and achieve that result, that means the consultation is successful, because the entire process of meeting somebody for a consultation is to determine the image that they are hoping to achieve in their head and what I'm able to achieve with my hands. If they're equal, then I think it's okay for the patient to go ahead with that, and I know that I can achieve an outcome that they're looking for, but also that they're in a safe space emotionally, mentally, that they can that this is indeed something they can go through and want to go through.
Right, and then you have that therapeutic process that you bring them through, so you can even further help them to define, refine what the outcomes would be, it sounds like.
Absolutely.
Yeah.
Yeah.
So let me ask you a question. In looking you up and doing some research, I've seen that you have really been recognized for a lot of your contributions in plastic surgery, specifically around scar minimization. And I'm just wondering, why is that so important in the process of doing this work?
Yeah, so scars, for a long time, the concept of like a scarless surgery was sort of the holy grail of plastic surgery. It's like almost like waving a magic wand, the ability to do something with the body, to the body, and have no evidence that something was done. And, today it's still not fully possible to do something without any scar, but we can minimize the scar and make the scar less visible. So that's really important, just because most patients do not want any evidence, or they want the scar to be as small as possible. So it's first of all, so there's no evidence that they may have had a procedure, because patients want to protect their privacy around sensitive things like that. But also, scars can be disfiguring. So
Hmm.
minimizing the appearance of a scar has been a goal for in the world of plastic surgery for a long time. I did develop a technology almost 10 years ago that involves manipulating the scar with a Band-Aid type tension device.
Hmm.
Um, and because we know as the scar heals, if tension is applied in the correct direction, it'll actually minimize the appearance of a scar. And that's something, so it's been an interest of mine for a long time. And that's a device I created a while ago. But nowadays, most of the surgery I do is through a tiny little entry point, um, which the scar is, just a few millimeters in size. It's like more like a
Hmm.
dot. And that's the tools I use to remove and harvest fat are done through these small entry points. And an entry point is a really small scar. And if done properly in the right setting, it can be almost invisible. Of course, everybody heals differently, so sometimes it can be a little bit more visible for other people.
Hmm.
But the idea is to like, in the trend that I see in this world is that scars become less and less visible. The idea is to be less and less invasive, more and more, to the point where maybe eventually there will be no scar whatsoever.
Hmm. Well,
Yeah.
I'm really I'm bowed over and humbled by the work that you're doing, and I really do see your work and a lot about your mission really helping people feel more confident and empowered. I'm wondering, what kind of impact do you hope your work will have on society? Do you see a broader adoption for this, surgery as a ceremony, the whole idea of intention setting, the whole idea of helping people through the process? What's your view?
Yeah, my hope is to be a an example for other practitioners in this space to honor the medical experience as a deeply transformative process. Specifically in the surgery world,
Hmm.
I hope um, that more plastic surgeons can address the psychological, um, the profound psychological impact that surgery has for their patients, and to incorporate more of that so patients will continue to have better outcomes after their procedure. But I see a much bigger vision also in the world of surgery. There's over 1 million surgeries done a year. Every one of those surgeries is a potential for a profound transformative shift for somebody. A patient that's undergoing any surgery, and I don't mean just plastic surgery, I mean literally any
Hmm.
surgery, whether it's heart surgery, orthopedic surgery, like any surgery is an opportunity for somebody to take pause, to
Hmm.
have their providing care team honor and address the shift that they're going through, and to create lasting transformational change on the other side. And
Hmm.
that is my longer term bigger vision, which is that there is such potential for transformation there. And like at scale, something like that could be really profound. Like anytime somebody's undergoing a surgery, if it's not just their body that's changing, it's their mind, that creates serious ripple effects.
Hmm.
We
Hmm.
we
Hmm.
we have this experience, and like it seems like almost any book that's ever been written by somebody who's undergone like a major near-death experience, which is, in some ways what surgery is. That's a very powerful transformation of the ego, and the mind, and the 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 thought that anyone undergoing surgery could be having this transformational shift and want
Hmm.
to make a huge lasting impact on their life on the other side, I think is really powerful, because that starts to every person potentially in that person's community or immediate bubble will also feel
Hmm.
the ripple effects of that, and that does create this lasting
Hmm.
change on a really big global scale.
Hmm.
But I'm starting with one patient at a time with this incredible team of providers that I work with, and the hope that this continues to grow and become something more.
And that's absolutely not only beautiful, but I think the research proves it out that bringing a sense of intention, bringing a sense of the sacred to the science, the medical to the mystical, and really looking at, a bedside manner. I mean, it used to be called bedside manner, in terms of helping the individual to feel that what they're going through is a mystical experience, is a transformative experience. The outcomes are far better. So it's really wonderful to hear you talk about that, and it's great to really have you as a speaker at Wonderland. You're going to be a speaker. You're going to be working. You're going to be doing fireside chat. You're going to be working with Dr. Kat Meyer on that, and I'm wondering, can you tell us a little bit about what attendees might expect from your talk with her and this fireside chat, if you will?
Sure. It's going to be exciting because this is the first time that Dr. Kat and I are going to be speaking together on this topic, even though we've worked together for some time. And what we're going to do is really go into the detail of what it's like to carry patients through this experience of surgery as ceremony. And she's going to share her experience as a psychotherapist and the role that ketamine plays in that process. And then I got to share my perspective from the surgery side. And then we're both gonna just share what the patient journey looks like, and everything from some talk about the protocol and the details about how we address that, but also touching on some of the things that we've touched on here, which is what is it like to be a patient nowadays when you have not just the body adjust, but also the mind.
Beautiful, beautiful. Well, I want to thank you very much for being a part of the Wonderland 2023 conference and the Mindfulness Experience podcast. How can people get a hold of you and find out more about your work?
Sure. Thank you so much for having me. It's been a real pleasure to share and talk about this. The best way to find me is probably on Instagram. That's my Instagram handle is drjon.k. That's drjon.k. And from there, you can find all the information about surgery ceremony, my website, and how to get a hold of me if you have any questions.
Great, great, great. Well, thank you very much. Well, that's all we have for today's episode of the Mindfulness Experience podcast. I want to extend a huge thank you to Dr. John Kanevsky for sharing his insights, his philosophies, his expertise. And to learn more about Dr. Kanevsky's work, visit his website at auraclinic.com. Don't forget to use the discount Mindfulness20 when registering for the Wonderland Miami 2023 conference. For more inspiring conversations with leaders in mindfulness, wellness, tune in to our next episode. Until then, keep living mindfully.